All right, welcome to the Mint Condition Podcast. I'm Brad Clementson, the host. Today, we've got an amazing doctor with us. He's actually been on before. He's going to be teaching us about how to work on your mental health, your brain health, and just live a mint condition life. So we've got Dr. Worley.
Yeah.
So thanks for joining us again.
Thanks for having me back.
So since last time you were here on the podcast, what's really cool being early on in our careers, I feel like we learn new things every week, right?
So many new things.
Right.
Yeah.
What is maybe the biggest change? Like, you've learned a ton, but one of the biggest things that's shifted.
As far as what? As far as like business goes, as far as treating people goes?
I would say as far as treating people.
Treating people?
Yeah.
The biggest thing I think is individualizing patient care.
Okay.
Right. So a lot of people have these protocols and things like that, especially because I deal with the brain exclusively. The brain is complex.
Yep.
You can't just have a one-size-fits-all approach. So some people need exercises combined. Other people, they just need their exercises individualized. For example, one of the exercises that you can do for like the cerebellum, which helps modulate pretty much everything, is you can do something called counter phase figure eights on that same side. So on the, let's say we're doing the right cerebellum, we can do a right counter phase figure eight. I don't know if you can see this on the camera, but basically I'm doing a figure eight with my, or like an infinity sign, with my right arm, and then the opposite direction with my same side leg.
Yeah.
They always want to go in the same direction. Okay. So I can do that to ramp up the right cerebellum, but I might need to do that with a vestibular exercise. Okay. So
Like what?
So for example, if I have and to kind of back up, the vestibular system is part of your balance system. We have two of them. We have one on either side. Literally, it detects any kind of motion that our head does. So what we can do is we can look at our thumb and we can, let's say, rotate to the left, just like this. And we could do, it's hard to do the leg too, but we could do a right arm cerebellum with that rather than just...
Are you moving your whole torso or just your neck?
Whole torso. I like
torso.
it in a spinny chair, like a little office chair that can rotate all the way around.
So you're not moving your body as much as your body's moving.
Correct. Yeah.
Okay. So if you can push on the ground.
Exactly. Yeah.
Okay.
So my eyes are locked in on that thumb, and basically what that's doing is it's down regulating an overactive canal, because when you turn your head to the left, the eyes want to go in the opposite direction. That's the normal response. But if you look at your thumb or a target or anything like that, and you inhibit that from happening, it can actually calm down an overactive canal. Then the cerebellum helps fine-tune the opposite side as well. So it's kind of fine-tuning the gain of the vestibular system. So, but some people, that tanks them. I'll retest them, and then it makes them worse. We have to separate it. So that's what's so different is like some people... doing it individually doesn't help, and then other people, it's the combination that needs it.
And with what I'm, the analogy I'd put to that is, with physical therapy or with just exercise, I'm going to start by walking a mile, then jogging a mile, maybe walking 10 miles, then jogging 4, right? And gradually. Yeah. But with this, it sounds like it's not
it's
for
not
everybody.
Step by step. So, for example, too, like standing up is usually harder for people, and you don't.
You mean standing during this?
Correct. Sorry,
activity?
Yeah. Okay. So standing up when you're doing the exercises is typically harder for people, neurologically speaking. However, that's not necessarily a progression that we need to get to.
Okay.
Sometimes just staying seated is plenty for the patient. So it's not like, oh, once we get this down, then we're going to go to here. It's once we get this down, that means that the pathway is now fixed and it's hardwired and it's rehabbed and things like that.
Yeah, and then it just applies into everything else you're doing.
Yeah.
That makes sense.
Yeah.
That's cool. Tying that into business then.
Sure.
Which is sad that we have to do this, but healthcare is still business,
it
right?
Is, yeah.
We got to stay in business, provide for our families, whatever. How do you grow then when you're in such a specialized...
Education.
Okay.
Teaching people about what you do, I think, is the biggest thing. Because a lot of people that I see and that I get in for an exam, they're like, I had no idea this existed. And I'm like, yeah. And so that's why I, have my social media and things like that, because I'm constantly trying to teach people that, hey, we don't have to be on medication the rest of our lives.
Right.
Anything that's like chronic like this, there's a root cause. There's a reason you have anxiety. There's a reason you have depression, panic attacks, all those kind of things. And we just got to figure it out. It's not going to be found in a drug and things like that are just Band-Aids. They might make you feel a little better in the meantime, but it's not getting to the root cause. So that's what I like doing, is actually getting to the root cause. And when I share that with people, then they're like, oh my gosh, this just clicks. This makes sense. And then they start sharing everybody. Literally, I started my practice. I graduated in April, started right after that. And I have a couple week wait list right now. It's not crazy long or anything like that, but in just, how long has it been? 8 months, 9 months, something like that.
Right.
Like that's, and it's all word of mouth.
Yeah.
I haven't spent a dime on marketing.
Well, and so that's how you've been able to grow your own brand.
Correct.
How do you multiply, like, because a lot of medical places will create systems, then they hire techs or MAs or something to run their programs.
For sure.
So how are you going to expand where you're more than just you?
So I can hire different doctors,
And
train
teach them
in
how to fully assess?
Correct. Yeah. So it's kind of like okay, if I'm seeing this, then it's likely this, this, and this, and just kind of going from there. So it takes time to learn that, and there's different courses you can take and whatnot, but definitely having a doctor that can shadow me and see, okay, I'm doing this, this, and this. And then the other thing too is I can have assistants run the exercises with the patients, and then I can interpret everything. So I could always grow it that way as
That's
well,
cool.
to where I can literally have, like one of my mentors, he sees about 13 people a day, and the way that he has it set up is like goals. So he has a scribe. The scribe has a radio, can talk to the different assistants out in the area. Everybody's running through their circuits of laser therapy. They're doing vibration therapy. They're doing a gyrostim, which is basically like this. It's kind of like one of those space things, and it's extremely specific on how they're rotating. They do a couple other therapies as well, and so they're basically going through these like circuits out there, and then whenever he's ready, he just calls them in. And it just,
cool.
It flows so well. And that way he can see a lot more people. And I mean, he works like 9 to 12:30.
Yeah.
That's it.
That's great.
And he's able to see so many people in that time too. And he's got great work-life balance and things like that. So
that's awesome.
That's the goals for me.
Yeah, I love that. I think when you have such a specialty thing and it's something that's missed by most medical field people, like how many doctors, PTs, chiropractors know about what you do? And not just, I'd say the percent that even know about it is small, but the percent that actually somewhat understand it, right? That have actually sat down with somebody like you to understand it deeper.
Yeah.
I'm a really big fan of neurologic resets. So I've been studying how to improve our habits, right?
Sure.
The micro habits, the macro habits we have. And then if you want to create a new habit, how do you make that a thing that isn't fleeting? They say 95% of our day is subconscious or habit driven.
Absolutely. Yeah. So, and that's the hard part. You're conscious only a certain amount of time on that thing that you're trying to do. So I think repetition is the best thing. And there's something called the reticular activating system, which is essentially an area of the brain that is like a funnel. So we have so many things that's bombarded on our brain, visual stimulus, sound, like all these things that our brain has to filter out. It has to know what's important and what's not. So you can then train your brain to know what's important. It's the same concept of like, you get a new car and then now you see that new car everywhere.
Yeah.
Same concept, because your mind, it was always there.
Right.
Not everybody just bought it at the same time that you bought it.
Right.
So whenever you're focusing on something, and
so it's not the Matrix.
That's correct. Yeah. So this could be something negative. This could be something positive. Do something positive, because if you're just always thinking negative like that, that's all you're going to see. So it's extremely important to be positive, because your brain's listening. So even if you feel kind of negative and whatnot, have a positive spin on that. And that takes time, that takes practice.
Yeah.
But that is amazing for the mental health, because it's like the positive affirmations and things like that. Like those, it's not going to override a possible broken neural pathway system and stuff, but it is going to help you handle it properly.
Right.
And it's going to help tell the amygdala, that fear center, to help calm down.
Right.
And then you start focusing on the positives, and then it's basically the manifesting. Manifest what you want.
Which is an interesting balance, because there's manifesting, the idea that I'm going to say it and and the universe is going to create that.
Right.
And then there's the concept of you say something positive, you'll recognize it more. I was reading some stuff about marriage and making your marriage successful. And when you hyper focus on my wife's amazing, except for this, you start to see more of the things that are a problem.
Same concept.
So all I do every night is I write in my journal the things that I love about my wife.
Yeah.
And what's really cool is that list is getting longer and longer. And the list of things that she does wrong disappears.
Yeah.
And I'm like, man, she's flawless. And that's a great way to live.
Exactly.
And so I love that idea. But I'm even more obsessed with the idea of what energy you put out reverberates back.
Of course.
So I think that's really cool to that you emphasize that. Like say more positive things, focus on the positive things. What car you buy, you see everywhere. What things you say, you see everywhere.
Yeah. There's a lot of like habits and reflexes that we can change. So if you see somebody that, I don't know, that if you just initially have like a negative thought about somebody, like, oh, they're
bald.
They're bald, or their mustache,
Right.
or something like that. Just kidding, I love your mustache. Anything like that, and you just like initially have a negative thought, you gotta then think, okay, let me think 2 or 3 positive things about them. You're tall. You've got beautiful blue eyes. Things like that.
Yeah, I love that. Man, I got to hang out with you more.
Absolutely.
I feel good about myself.
Things like that to just basically switch that mindset, and then eventually that reflex is going to stop happening.
Yeah. So one concept that I've tried, and I want to hear your thoughts on this,
Sure.
is deep, fast breathing. So take deep breaths in and out. So it's going to be slow because you got to go all the way in. It's not, hyperventilate isn't the idea. And do 25 of those.
Yeah.
And the idea behind that was to force your brain to be ready for a reset and then follow it up with doing something very different. So like brushing your teeth with your left hand.
Yeah.
Or non-dominant hand. Then your brain's now ready. And then immediately after that, what's your new habit? I'm going to read every morning for 30 minutes. So I'm going to do 25 deep breaths fast, brush my teeth with my left hand, then read for 30 minutes. And that primes my brain to say, okay, this is a new pathway. It's like going hiking and being like, nope, I'm hiking this way. And there's no trail, but I'm doing it anyway.
Right.
What are your thoughts on that?
Love it. Yeah. Doing something that kind of stimulates the brain in a different way is obviously amazing. So, and then it can prime it, and then it's now more aware of all these different things. So whether it's brushing your teeth in a non-dominant hand, doing something like a vibe plate. My fiance just got a vibe plate. So it's like a plate that basically just kind of like shakes. It can do like circles. Ours just goes left and right, but you stand on it, and basically it's so intense that you don't need to do it long, but it can help with like circulation, lymphatic flow, things like that.
Anything like bone density?
It can.
Okay.
Yeah, it absolutely
I've heard
can.
about stuff like that for older adults to improve balance.
For sure,
stuff.
yeah. So that one, I use it for vestibular work. So basically the way that it works is when you're standing on this vibe plate and it's going left and right like that, it's basically shaking you left and right. And we have something called the otoliths, which is part of the vestibular system.
Right.
And those detect motion in the horizontal plane. So when you're moving left and right like that, it's kind of stimulating that. That then goes to the vestibular nuclei, which is located in the brainstem. Then from there, it goes through the lateral vestibular spinal tract, which essentially goes down to your legs. And then you get proprioception in the muscles that then send it back up to the brain. And it's kind of like, whoa, what just happened is essentially what the body's doing.
Right.
Because it's trying to stabilize you because you're not stable.
But the ground's constantly moving, so it has to
I do like 45 seconds on it. That's it.
Per day or a couple times a week?
Maybe I'll do it like, I'll probably do it once in the morning, maybe once in the evening or something like that. Not a lot, but then you step off immediately afterwards, and then it's calm. And then now your brain's like, oh, this is what calm is. So if you feel like kind of like agitated and things like that, doing something like that is essentially a reset. It's kind of like, resetting the nervous system is always an interesting term because I'm like, what does that actually mean, right?
It's not like a computer. Turn it off, turn it back on.
And that's what people kind of think about with that. So it doesn't necessarily work that way where you can just kind of reset it, but it's like, it's just pumping the brake for a second, and then it's like letting the brain kind of figure out, this is what's happening. This is
where
right.
I am. This is, yeah.
Because especially the cerebellum helps correct errors.
Okay.
And so if you have these errors, if you have like these pulls, if you have anything like that, the cerebellum, if it's fired like that and then you step off and then it's calm, the cerebellum can then kind of like fine tune and be like, oh, this is what calm is supposed to be.
Right.
It has a closed loop circuit, essentially.
Yeah, I think of it as like random chaotic communication or traffic.
Yeah.
If we were to just want calm, peace, then you don't want signals bouncing off walls, getting a text message and an email and a fax all with the same information, or you text me one day, then you email me the next day, then you call me, and it's like I never know how to communicate with you, right? That's what I feel like our brains have, and even more so now because of technology and the high demand. Right? What we are supposed to achieve in a day is just so much more than before.
Oh, yeah.
And so you need that calm, that peace, get back to that level.
Absolutely.
That's where I feel like other providers need to learn about providers like you, that where physical therapy, it's like, man, I'm so frustrated, I can't get someone better. Well, that's because you're working on one channel.
For sure.
Right? And you're trying to fix whatever that is or reduce inflammation or whatever, when the entire system is messed up.
Yep.
And so what have you seen with people, like let's say they have a rotator cuff surgery, that messes your nervous system up.
Absolutely.
What have you seen? Have you been able to work with some of those people in the short time that you've already been in business, where you can help regulate their nervous system so their rotator cuff surgery heals better?
Absolutely. So whenever you're stuck in that fight or flight, then you're not going to heal, right? Your brain isn't worried about fixing that rotator cuff. Your brain is worried about keeping you alive, right? So that's the biggest focus. So cortisol might be too high, and other stress hormones that essentially inhibit your body's ability to heal. So calming the nervous system through and figuring out why it's ramped up in the first place. It's not just a matter of pushing the vagus nerve. So doing like gargling, singing, humming, vibration, things like that, because that's going to essentially push the brake, right? Which is amazing. But why is your foot on the gas in the first place, right?
Push the brake and you're still pedaled to
exactly.
the metal.
It's going to slow you down, but as soon as you stop doing it, guess what? You're still going to be flooring it. So we got to figure out why your foot is, and it's different for everybody. Some people, it's, their vestibular system. Some people, it's their cerebellum. Some people, it's their cortex. It's other areas of their brain that's causing their foot to be down because of some kind of dysfunction. And this could be from a concussion. This could be from a virus, a mold exposure, heavy metals, parasites, microplastics, things like that can cause this inflammation and damage and state of, hyperactivity, essentially. So too many people, I think, focus on vagus nerve. Let's push that. Let's push the parasympathetic. But that's not the right approach. We got to figure out, why are you stuck in that fight or flight anyways? So calming the nervous system, to me, is figuring out, why is it ramped up in the first place?
Right.
We fix that, and then the system is now calm. Then healing happens. Because guess what? When your brain is working harder than it needs to, you're using up so much energy that you're not able, and resources like dopamine, serotonin, things like that.
Are we talking about energy burning calories or just dopamine and other things?
Calories essentially, like ATP, your brain's currency, things like that. I don't want to say calories because a lot of people are going to be like, oh, my brain's dysfunctional, I'm burning more calories, I'm going to be in shit. Like, people think about it that way.
And that's what I was thinking when we're talking about more energy. It's your body has said, here's your daily dose of energy for your brain.
Yep.
And your brain put all of that into dysfunction. Yep. And they're like, man, why can't I connect with my wife? Why can't I be more productive at work? And it's because that dosage of energy was utilized unproductively.
Absolutely. That's a great way of putting it, and that's why people, I think, get, the chronic fatigue, and they're not sleeping well and things like that. They're not recovering. Their brain's not draining at night, the lymphatic system.
Right.
So it's just their brain's working harder every single day. They're not sleeping. They're not recovering. It's creating these plaques, and that can lead to like brain fog and memory issues and all these kind of things. The shoulder, that's the last thing on your body's mind and your brain's mind,
Yeah.
is to fix that. So that can absolutely delay healing, especially if it's like a knee or like a hip or a foot or anything like that. Part of your balance system, if that's off and you're having to use this dysfunction, it's going to take so much longer because you're going to be compensating and things like that. So it's really important to get your brain working the way that it should, and calm it down so that way, because essentially that's what I do. I don't heal all these different things. I get your brain working the way that it should, and then the brain's in charge of healing.
Right.
It's in charge of allocating the different resources to where it needs to go. And if you're essentially in debt because of all the damage, then you have nothing else to spend it on.
Yeah, the reason I get so excited about this stuff is I don't mean to sound super negative about my profession, but I feel like this is what's missing.
Yeah.
Like physical therapy, it's like frustrating as all get out. I'm like, man, why can't I just get you better balance? If they would just stand more, they'd have better balance. And there's some aspect of that.
Sure.
But it's treating the cause, not the symptom.
Absolutely.
Somebody's got bad balance. Now, I'm not saying they don't need to work on balance. You got to challenge it. But if their brain is dysfunctional, then doing that is just, you're beating your head against the wall.
Yeah.
You're using a bucket, get water out of your boat, not plugging the hole, right?
Exactly.
And physical therapists in general need to do this better, but especially now, PTs are primary care providers.
Yeah.
And we have to think like a primary care provider. Now, I'm not saying we're diagnosing cancer and all that. Obviously, we're not. But what I'm saying is we have to refer out. How many PTs refer out? Almost ever, right? A physical therapist, every PT should be referring to you and saying, hey, can you quickly fix the brain so that I can help them heal their body?
Oh, yeah. I'm not taking away, and sorry to interrupt.
No,
I'm
you're
not
good.
taking anything away. I'm helping your patient get better faster. And that way, it's the same with chiropractic too. It's not just PT, but I'm helping your patient get better faster so then you look better. Because you're like, hey, like you don't want somebody, especially after an auto accident, they're just like, yeah, I got better, but like I still have some lingering stuff.
Right.
Why do you think that lingering stuff is? You're trying to do habituation. I always talk about this, doing the same thing that makes you feel worse until it doesn't make you feel worse anymore. That's your brain's way of compensating. It's not actually fixing what's damaged.
Right.
So when it comes to, when it comes to me helping out with the brain, it's just making people get better faster. It's not taking away. I'm not doing anything that you're doing. It's not competition.
Right.
It's working together because the patient should be the focus, right? I don't care how somebody gets better as long as they're getting better.
Yep.
And you can't just do, for balance, for example, you can't just stand on one foot, toss a ball, use the Bosu ball and all that kind of stuff. That's working the entire system.
You just took away my entire career.
Sorry.
No, I'm just kidding.
It doesn't isolate where the dysfunctions are.
Yeah.
We have 14 different brain areas that go into our balance system.
Yeah.
We have 3 semicircular canals. This is part of the vestibular system on either side. We have 2 otoliths on either side that detect horizontal movement and vertical. So that's like gravity.
Right.
And then we have the left side of the cerebellum, the midline cerebellum, and then the right side of the cerebellum. And all of this goes to the vestibular nuclei. So all that information then goes to the vestibular nuclei in the brainstem. 14 different brain areas. Is it overactive? Is it underactive? What combination of those 14? If you just do standing on one foot and all that kind of stuff, you're working the entire system. You're just going to rely on what's actually working,
Right.
rather than fixing something that's overactive versus underactive. Like my example in the beginning, where I did that's for the left horizontal canal, that example, to tone that down. But what if the problem is actually the right side that's too weak? Then we can ramp that up by doing different exercises like that.
Yeah, that makes sense.
So we just have to be so specific. And I think that's where a lot of people are lacking. A lot of these providers is they're not specific enough. So.
Yeah. Well, and I think getting back to like a PT being a healthcare provider is realizing it's okay to utilize a team, or not just okay, it's mandatory. You should be doing that. And so their care looks like work with you for 3 weeks, now do their rehab, and they get better way, way faster.
Oh, yeah.
And as a physical therapist, we stand on the other side of the aisle and we look at surgeons and say, why are you doing surgery on every single person?
That's a great
You
point.
should be sending them to me. It's not a competition. Get the patient the care they need. Well, as a PT, we need to send to you and get them the care. And if all they need is you, that's great.
Yeah.
And then the community can trust me because I'm going to get them to the right person.
For sure.
Or help them if I'm the right answer.
You're that gatekeeper, yeah.
Right. Or work together. You start, and then their balance rehab is more effective and faster.
Yep.
Right. Instead of working on it, some of the patients, I mean, I just wish all of our home health patients could get to you.
Yeah.
Right. Because we're working on balance with so many of them. And yeah, some of it's from inactivity. Right. But inactivity leads to downregulation of the brain.
Yeah.
And just by increasing their activity means lift with what's ever strongest.
Right.
If they've got 14 systems, they're going to use 2 or
Exactly.
3 or 4 to do everything.
Exactly.
And then 3-4 months later, they're not active. So then their balance gets worse.
Yep.
So if they could have simple things like figure eights
Yeah.
that they could do once a day just to keep a certain part of their brain active, I feel like it would really improve the longevity for all of these patients, reduced falls, reduced hospitalizations. Honestly, I wish it was less patient specific, so that we could.
It'd be easier, yeah.
It'd be so much easier.
Let's have this program.
Give us a
everybody do it.
program,
Yeah.
and we'll do that as part of the PT. But
But that's the other
unfortunately,
thing.
that's not.
That's what everybody else is doing, right?
Yeah.
So like I look at a lot of like vestibular pages and websites and all that kind of stuff. They're literally all doing the same thing. And that's not the best way to go about it.
Right.
You can fix a system so fast, especially if you're just recalibrating it. If you have to strengthen an area, it's kind of like a muscle. It can take some time. But if all you have to do is just match the eyes with what the brain is thinking, it's fast.
Yeah.
And then people are like, oh, that's what calm is supposed to be. You know, I've had several patients just start yawning in my practice. Their brain is finally in that rest state.
That's cool.
After an exercise, literally they'll be like, and I'm just like, well, that's a good sign, you know? I had a patient, older lady, she was, I want to say in her 80s, flew out from California to come see me, balance issues, you know, a lot of that kind of stuff. And she flew back and she was just like, Ryan, I feel so euphoric, and like I promise I don't do drugs. She's like this old lady, and I was like, I didn't think so, but she was just like, I just feel like this like euphoria, and I'm like, that is your brain finally feeling calm after who knows how many years. So it's so important to be specific to the individual to get their brain feeling calm.
That's cool.
So,
Man, I just want that for everybody.
yeah.
I feel like we often think about the worst case scenarios, right? Like you said, the ones where it's going to take me 2 or 3 months working with somebody to strengthen the brain. But it sounds like most people, everybody should just come meet with you once a year.
Oh, yeah.
Regulate their brain back, make sure, hey, can we hit pause? Can we know what calm looks like?
Yeah.
If every single PT with every single patient was like, hey, 1 week, 2 weeks
Yeah.
with Ryan, then we start rehab, or even rehab can start during that, but it just sets up the brain for that. Am I taking this too far?
No, not at all. So essentially, like, okay, what controls the muscles, for example? The brain does.
The brain.
The brain literally controls everything.
Yeah.
So if that is dysfunctional, especially like in the PI world, like car accidents, things like that,
Yeah.
a lot of times even a whiplash affects the brain or the body's schema. So like you're basically like your proprioception of where your body is in space. So if that map is off, it's going to be so much harder to get the change that you're looking for if you're just working that area. So if your hamstrings are always tight, why? You're stretching them. Your brain doesn't feel safe to relax them.
Right.
It's not a short muscle. Under anesthesia, you can Gumby a patient.
Yeah.
Their brain is essentially shut off with that. So it's not a short muscle or anything like that. It's their brain not feeling safe. So getting people's brains to feel safe, that is the name of the game, like I said before. And I think that if every provider, like PT, chiropractic, things like that, if you're dealing with somebody that's having like a chronic issue, then you got to look at the brain. What's the brain doing? What's the brain's perception of where they are in space and things like that? Like, I mean, One of the things when I first started as a doctor is I would cover different chiropractic clinics whenever they were injured, sick, vacation, whatever. And I would ask people, I'm like, hey, you feel like you're getting better, things like that. They're like, yeah. Some people, yeah, awesome. Some people are just like, yeah, kind of. I still just have like this lingering. I have to come in every week, otherwise I'm a mess. Why? That's not normal.
Right.
And then the chiropractors are just like, sweet,
That's what they need.
repetitive patient,
Yeah.
that's money in my pocket, and I just adjust it. It feels better for about a week or so, and then they come back in. But to me, I'm like, that's not normal.
Right.
We got to figure out why. Why is their neck always out? Why do they have a head tilt? Why is their back always? If it's something chronic, we have to ask why. We're doctors. We're smart. We should be.
We
need to figure out. Let's actually use our brain. Let's not just, oh, I feel a restriction, boom, send it.
Yeah.
Okay, now it's free. Why is that same restriction always happening?
Right. Why does that keep coming back?
Yep.
And yeah, there are physical changes that need to happen, with scar tissue or joint alignment and the way the body moves and holds itself. But the nervous system is your strongest system.
Yeah.
I learned that very early on.
Yeah.
That when anything I was doing, I was like, hey, how is this affecting the nervous system? Mm-hmm. Even if I'm like doing passive range of motion, I'm thinking lubricating the joint, but I'm also thinking, more importantly, how is the brain perceiving this?
Yep.
Because that's what's going to control everything. Man, I love that.
Yeah, passive versus active alone.
Yeah.
And we can go on a tangent of this, but that affects the brain so differently. When you're doing something passively like that, the brain is not in control of that movement, so there's more error detection. And so it's like, wait, why is this happening? Things like that. So it's interesting. And some people need to do, same thing with my exercises. Sometimes they need to be doing it passively. Like the example that I did before, their feet would be up and somebody would rotate them as opposed to them rotating.
Them pushing. What about like your figure eight,
Same
someone
thing.
hold their arm and do a figure eight for
Same
them?
thing. Yep.
Interesting.
Exactly. And some
That's
people,
cool.
They don't need to start off with passive. Other people, they do.
That's really cool. So how do we help our community, our healthcare providers, to reach out more, to work together more, to help patients live healthy instead of just get treatment?
For sure. I think have as many tools in your tool belt that you can, and as many, resources as you can to send to, because the patient's the number one priority. So if the patient is, suffering and you're barely getting them better, you might be missing something. So whether that's nutrition or, different exercises or their brain or whatever it may be, don't be afraid to pivot and be like, you know what, this patient isn't getting as better as much as they should. I need to pivot and kind of go a different direction. And it's the same thing with me. Like there's cervical issues that can then affect the brain as well, because there's a feedback going both directions. So if I'm fixing the brain, but they're still not completely getting better, or for example, if they have toxicity like mold, parasites, all those kind of things, I'm fighting an uphill battle. So if my exercises aren't sticking, I have to be humble enough and smart enough to be like, it's not because they're not doing their exercises.
Right.
It's typically because there's some other underlying factor.
Yeah.
So just, as a provider, knowing how to go about being like, okay, if this isn't happening, then this is the next step. Or if they're not getting completely better, then this is the next step. And educate the patient. Patients are not stupid. I hate when I see this a lot with like medical doctors. They're just like, I'm the doctor, you don't need to know this. Just kind of like, take this or whatever. I educate my patients on everything. Yep. I show them, about their vestibular system. They want to know why they're feeling the way that they're feeling.
Yep.
And they're not stupid. They can understand this stuff. They don't need to know it on the level that I know it, but I can break it down and teach them like, hey, this is what's happening. This is why, when you go to grocery stores, you feel kind of like off and things like that. And then they're like, oh, that makes a lot of sense. Or this is why, like one of my testing tests for basically social anxiety or like your social battery wearing out. So like a lot of people that are just like, I just need to go home and recharge. I can show them why that's happening. And that just clicks for people. Sorry if that was loud. That just clicks for people. They're just like, oh, that makes a lot of sense. Like, because yeah, by the end of the day, I'm just like exhausted. I just need to be alone for a little bit. So I think I answered your question, but I
No,
feel
you-
like I went on a tangent. Sorry.
No, which is great because this is exactly what we want to learn about.
Yeah.
Like, how do we as physical therapists, as healthcare providers, and patients should know this to look for it or ask for it when you're talking to your doctor. Ask them if they've thought of other things. There's
sure,
nothing
yeah.
wrong with that because as doctors, we get in our routine, we get in our, and most of us are really good intentioned,
Yeah,
right?
absolutely.
And you, if it's not every day, if it's not every patient, sometimes you forget to think like mold in somebody's shower is not something I ask every patient about.
sure.
But I probably should.
Yeah, it
And
definitely
so,
could. Add
so
that
as
to
a
your intake
patient,
paper.
yeah,
Yeah.
we should.
Yeah.
We should advocate for ourselves as patients to say, hey, I love what we're doing. Have you considered, like, what other things have you considered?
Yeah.
Maybe you're not the one making a recommendation. I promise most patients who come to me aren't thinking, have you considered sending me to Dr. Worley, right? Like, but as a patient, you could say, what other medical providers have you considered including in my care?
That would be amazing.
That'd be a
that
perfect question.
alone will get the provider out of their routine and to be like, oh, and that's the other thing that, like, I know that you spend a lot of time with your patients. I spend a lot of time with my patients. A lot of other providers, especially in the conventional world, 8 minutes and then
Yep.
they're over.
Yep.
But I love that brainstorm with the patient.
Yeah.
Let's work on this together. I'm your advocate. I am on your side. Let's figure this out. Have you tried this? Okay, what are your thoughts on this, this, and this? I'm guiding the conversation, but it's their life. It's their body. It's their brain.
Yeah.
They know how they're feeling. So it's really important to help guide them essentially. And that's the thing that kind of sucks is, patients these days do have to be their own advocates.
Yep.
Because there's red tape everywhere, and it's like, I would send you here, but they're not in network or whatever it may be.
Well, and the doctor won't even bring it up.
Or
like if you were to ask a doctor, hey, would you have sent for an MRI? Heck yeah, I would have. But I know their insurance wouldn't pay.
Yeah.
Who cares if their insurance wouldn't pay? The patient might be willing to pay.
Yep.
Right? Or have the resources.
Absolutely.
So what is the absolute, the right care? Not saying the best care, because the best care, I mean, we could all, what's the guy, he spends $1 million a year in order to live as long as possible.
Yeah.
Love what he's doing. Some great research and what he's doing will benefit society.
For sure.
Right? But we could do that.
Yeah.
But that's unrealistic.
Right.
So what's the right care for each patient in order to optimize their potential outcome, no matter the pay source? So,
Absolutely.
I love that. I mean, now we just got to revolutionize the whole healthcare system.
I think the biggest thing is just, and I don't know how to do this, but we have to take the ego out of medicine.
Yep.
I don't care how the patient gets better. Literally, I was a patient myself. That's why I got into what I'm doing. And I don't care who gets people better. I really don't.
Yeah.
So why are we like, oh, they're doing it wrong and all this kind of stuff? Like, I don't care.
Most of the time, and I've had those thoughts, right? It's ignorance,
Yeah.
right? When I first heard about functional neurology,
Yeah.
I was like, oh, so you're trying to be a PT. That's what it was my first thought.
Yeah.
Because we learned tons of neurology and neurologic rehab.
Yeah.
And then when we started talking, I was like, oh, never mind. What you guys do is really cool.
It's just different. Yeah. Absolutely.
And so you, like you said, get rid of the ego, think on a higher plane, get the patients better. And I promise when you focus on that, right? Like get patients better as fast as possible, you build that reputation.
Yeah.
People will seek you out because they know you'll get them to the right place.
Absolutely.
Or be the right answer, right?
Yeah.
And one thing you said earlier, I just want to touch back on, was broaden your knowledge, right? We often think, well, that PTA is a physical therapist assistant. They can't know this. They can. Maybe their licensure doesn't let them provide that care, but they should know it.
Yeah.
A chiropractor who doesn't want a PT doing adjustments. If a patient needs a minor adjustment as part of their rehab, maybe that's all they needed. Like, why wouldn't a PT be able to apply that, right? If you need more specific advanced ones, some PTs go that far, but most don't. So get a chiropractor involved and let's work together.
Yeah.
Same thing with chiropractors. If a patient that they're working with just needs 1 or 2 stretches or just needs this exercise, don't refer to a PT.
Yeah.
And are you saying, well, I'm upper cervical, all I do is adjust this, I won't show someone how to stretch a calf?
Yeah.
It's like, you got to know to ask about mold in their shower. You got to know if you don't know, you won't be able to recognize when a patient might need Dr.
yeah.
Worley
Yeah,
or
absolutely.
need a physical therapist. And it's your fault that you missed that.
Yep. And you don't need to know every area, every profession.
Right.
Like, you know so much about physical therapy, more than I could ever dream of. I don't need to know it. I just need to know when to send. I need to know when to send a patient to you.
And when
you know?
not to send,
And when not to send.
and simply provide the little bit that they needed.
Absolutely.
Right.
So, in kind of a side note, but like my fiance, for example, we did all her brain exercises. I might have said this on the last one, but we did all her brain exercises and retested her balance, and it improved. I have a little scale thing that measures like your bias, your sway, like all these things.
Yep.
And everything improved. She was like, "Oh, my neck is a little tight." So she was like, "Will you adjust me?" And I was like, "Sure." So I adjusted her, and then I was like, "Let's retest." So then got her back on. Her numbers were flawless. That was part of her issue. She needed that proprioception from the neck to the brain to be like, hey, this is where I'm at in space.
Yeah.
I've done that with other patients, and it's tanked them.
Yeah.
It's too much for patients.
Yep.
So just knowing when to, if that kind of stuff is good for their care, you just got to know.
Yeah.
So I don't need to know everything about the mold, the parasites, all that kind of stuff. But my testing can show kind of like hints that could be a factor. And so that's when I'll refer out and be like, okay, I think you also have this going on, but it's the same thing as like a nail being in a tire. Okay, we pulled it out, but now the tire's flat.
Yeah.
So we got rid of the mold, but now we got to fix the damage.
Yeah.
So it's not like, oh, you have mold or parasites or whatever, and I'm like
And that's
irrelevant.
Yep.
No, there is damage that's done.
Right.
We got to fix that. But if all we're trying to fix is the damage, you're trying to pump up a tire that still has a nail in it.
Yeah.
It's just going to keep getting flat.
I have to ask.
Please.
You said your fiance.
Yeah.
When are you guys getting married?
We're thinking May. We literally, I think it was last night or
That's
maybe the day before,
exciting.
we were talking about the actual date. But I think we narrowed it down to May.
That's
It's
cool.
going to be out here in Utah. Got a buddy that his parents' house like overlooks the mountains. And it's a
Nice.
beautiful view, and just down in Provo. So
That's awesome.
Yeah.
That's
So,
really exciting. I'm
yeah.
excited for you guys.
Thank you.
That'll be great.
Yeah.
Well, this has been super inspiring, uplifting. I think more physical therapists, that's who I can speak to, but chiropractors, MDs need to know about specialists like you.
Yeah.
Like people who are, one of my favorite things is POTS
Yeah.
or anything with the blood pressure changing. No idea that was so fixable,
Oh,
right?
yeah.
I thought habituation, that's how
Yeah.
we're going to fix it.
Yeah.
And doctors thought medication, that's how we're going to
Compression
fix it.
socks and like
Yeah.
all these different kind of like Band-Aids.
Band-Aids, yeah.
But why is this happening in the first place?
Yeah.
So,
So we need more doctors knowing that this is an option. We need more patients advocating for themselves and saying, hey, can you fix my brain on top of medication or in spite of medication, right? And I don't know, let's heal our society,
yeah,
right? You've answered this before,
sure.
but do you have anything to add about living a mint condition life?
Let's see. I forgot what I said last time, but
Me too.
basically, mint condition is perfect. When you have like a Pokemon card that's mint condition, things like that. It is like perfect. And I think that's the goal. We're probably never going to get there.
Right.
But that's the goal. We want to try every single day and not beat yourself up if you're not perfect.
Right.
Like the, what is it? The hard 75? Is that it?
I don't know.
Do you know what I'm talking about? 75 hard. Said it backwards. So 75 hard, for example, it's like, correct me if I'm wrong, but it's like read for 30 minutes a day, do this kind of stuff. It's just so intense that a lot of people fail, and then they beat themselves up that they failed, and then a lot of times they don't try something else again. They're just like, oh, I can't do that because they tried something so hard.
Right.
So living like a mint condition life, I think that's the goal. Shoot for the stars. You're not going to be perfect. We can't be perfect with all of our exercises, with our nutrition. Like, we have to still live life and enjoy it. But that should absolutely be the goal, is to be the healthiest, be the most positive that we can be. But again, just don't beat yourself up if you're not perfect, because none of us are. So just You know, if you have a bad meal, for example, don't have like the whole day just be ruined because of it.
Yeah.
You
Don't
know?
dwell on it.
Don't dwell on it. You know, just do better the next day.
Yeah.
Don't be emotionally invested in that and just be like, oh, yesterday sucked. Okay, now I'm going to be better today.
Yeah.
So,
Yeah, I like that. Living that mint condition life as a goal, and every day just striving towards it. We're not robots with the program. Put in the program, 30 minutes read, walk outside for 30 minutes. Like you're not running a program. You're living a life, and just constantly improving that to the next level. That's great. Well, thanks so much for taking so much time. And
thanks for having me again.
You're inspiring. You're
Thank you.
uplifting our whole healthcare profession. I think it's awesome that people can come and work with you, and you're going to do a couple sessions and send them on their way.
Absolutely.
Or if they have something that they really need, they can work with you for a longer period.
Yeah.
So it's very customized.
Absolutely,
So,
yeah. And we don't need a lot of visits. That's the nice thing
Yeah.
is we're figuring out exactly what the brain needs in honestly about 3 visits, and then you're doing your own exercises at home that I give you.
Yeah.
And they don't take long, anything like that. And one thing that I wanted to kind of do is for anybody that's watching, if you want a free exam, it has to be in person. It can't be virtual. But I use something called a VNG, which records your eye movements. We do a balance assessment. We do a tapping assessment, figuring out the function of the brain. If you mentioned that you saw this podcast, I will absolutely do a free exam for you. Usually I charge about $150 for that. So
that's huge. That's
so
a great offer.
I think that's clearly I love this stuff
Yep.
and I want to share it with as many people as possible.
Yeah.
So, and if you took the time to listen to this, especially to the end like this, I will absolutely do that exam for you. For free.
That's great. How do they reach out to you?
Instagram's great. Phone number, we can link it down below or anything like that. Website, you can reach out that way. I have my phone number on there as well. Email, you can do neurobalancesolutions@gmail.com. And yeah.
And what's your tag on Instagram?
Neurobalance Solutions. Yeah.
Okay,
So
cool.
that's my company name is Neurobalance Solutions.
Okay, great.
yeah.
Well, I hope everybody reaches out.
Yeah.
We definitely are going to have you talk with all of our physical therapists.
Sure. Yeah, that'd be awesome.
Okay, thanks, man.
Cool. Thank you.